मागीर करचें यो आनी पळय लास्ट स्लायडीन मरे शक्ती म्हणून येवं ना एसएचए आयलें तिथे शक्ती स्पेलिंग मिस्टेक्स ना न्ही येता न्ही मागीर कित्याक काडूंक ना सगळो
Nilesh.
Good afternoon, Anna.
I can see you. I can see you.
Okay, good to hear you after a long
Yeah,
time.
yeah, yeah, yeah. Uh,
Hi.
hi. We are waiting for, because we have got 100 plus students, so we are waiting for them to join.
Okay.
So a little more while we'll have to wait.
Yes.
Huh? Then a
Yeah.
small introduction of yours, and then you can start.
Certainly,
Okay.
yes. Yeah.
That's why we are waiting. today's esteemed guest speaker, Dr. Nilesh Korde, Principal Dr. Jojan Matthew, faculty member.
Yeah, thank you. Thank you. Yeah, it's a privilege actually for us to have with us Dr. Nilesh Korde, a well-known name in Ponda, not only in Ponda, in the whole state of Goa. I think that this is a seminar which we are conducting now. This webinar is, I think it's in the right time. I especially congratulate Dr. Anna Nina George, our Associate Professor and Dean Faculty of Education, Goa University, for organizing or taking the initiative for organizing a program like this for our students. And most of our students, I am sure that you are all going to benefit from this, and especially we are only a very few students who are boys. So I am sure that this talk is especially for you and for all the girl students, and you have to, pay undivided attention to this talk, women's health concern related to nutrition, hygiene, and grooming. Now, initially, when the COVID started, at that time, we were getting reports that there is some domestic violence and all that. And there are many issues that are specially related to women, and it is very very important as educationists we have to deal with it. Then only we will be able to empower our women. And empowerment is something which is very very related. I would say it is very much closely related to education. And without proper empowerment of women, it's not possible that we can improve the standard of women, especially in rural areas. Now, as I was just referring to this domestic violence also, I feel that this sort of women empowerment is very important as far as these sort of issues are concerned. Many of the societal issues that we are facing today can be solved by empowering women. And this talk that we have planned today, I'm sure that it is going to help all our, especially the girl students and all of us, to help our women to a great extent. And I especially thank Dr. Nina once again for taking this initiative. And especially we are very happy and privileged to have Dr. Nilesh with us today. And I also was his patient once upon a time. He may not be remembering me because it was long time ago. And he's a very well-known person in the land of Goa. There is no doubt about it. And I'm very privileged. We are very privileged to have you with us. Welcome, Dr. Nilesh. And once again, thank you to my colleague, Dr. Ananina George, for taking the initiative. And I'm sure that this is going to help all our students. So wish you all the best, my students. Please listen to this talk and be empowered so that you can face many of the issues that our doctor is going to deal with in this talk today. Thank you. Thank you, one and all.
Thank you, Dr. Matthew, for that really powerful, encouraging, and appreciation that you have given to all of us. And it has really motivated us. And we are becoming more eager to listen to Dr. Nilesh Korde. Before I invite the erudite scholar, the multifaceted, successful clinician, and diligent practitioner of Ayurveda, Dr. Nilesh Korde, to deliver his talk, let me take the honor of introducing him to the audience. Dr. Nilesh Pramod Korde was aware of the greatness of Ayurveda from a very young age. A world-renowned Ayurveda physician who was patronized by the Portuguese regime in Goa was his relative. The seed of Ayurveda, thus sown, further developed as he trained in Ayurveda in Bangalore, Karnataka. Besides academics, Dr. Korde always was keen to learn more about the clinical application of Ayurveda and how best he could be of assistance in relieving the pain and suffering of patients. On completion of graduation, Dr. Korde had the opportunity to specialize in Sharira Rachana from University of Pune. Dr. Korde had been associated with Gomantak Ayurveda Mahavidyalaya and Research Center in Shiroada, Goa for the last 28 years. In his capacity as the professor and head of the Department of Rachana Sharira, he has ignited many young minds to achieve excellence in Ayurveda. A multifaceted personality with varied interests in music, fashion, travel, and food, he had been an ambassador of Ayurveda not only in India but also in UK and USA, where he has been practicing and teaching for the 17 years. Presently, also, he holds the office as a director, Doman India International USA, founder director Ashwas India, a venture to train and promote clinical music therapy, and advisor for Ayurveda, a company from Switzerland, an international platform for Ayurveda doctors to give their services online worldwide. Chairman Sri Sai Swadhyaya Samiti, a spiritual trust in Goa, India. A renowned academician idolized by his students and a skilled clinician revered by his patients, Dr. Kode maintains he's still learning every day. Presenting before you Dr. Nilesh Korde, guest speaker on women health concern related to nutrition, hygiene, and grooming. Dr. Kode, the floor is all yours.
Thank you, Anna. Dr. Jojen Matthew, my dear fellow colleague, as I would call him, principal of your institute, and a long-term friend, Anna. We've known each other for a very long period. She's a renowned academician, as you all are aware from the field of education. Other faculty members of the institute, students, and all others who are present over here. I'm indeed extremely grateful for this opportunity that you all have given me to address intellectual minds who will tomorrow be educating and preparing citizens for my country. At the onset, let me just clarify that the talk will deal with the woman's body per se as how we perceive it and how we have to understand it. Later, about dietetics that are essential to maintain the woman's body. Beyond that, we will go and talk about lifestyle, and then we shall talk about grooming as such. All important aspects of understanding a woman totally. So let me just begin. I have got a PowerPoint presentation that I will be sharing very shortly with you. And from there on, I will be deliberating on the aspects that I consider as very important for all of us to learn and understand, as well as to keep in mind, because the perception of women from the Indian perspective is something that is much more than the Western world has understood. And keeping this in mind, I would like you all to associate with the thought, and at the same time, if there are any questions that you would like to address, I will be free to answer. I will feel free to answer anything that is within my capacity. So now on, I will share my screen and we shall speak on the topic on women's health. Is this visible to all? Please.
Yes.
Yes. Okay. Thank you. Yeah. Yes. Okay. That's me in brief as such. And this is your topic for today. Women's health concern related to nutrition, hygiene and grooming. I did add a little bit of lifestyle in that. Yeah. Now, all the feminists over here would certainly ask me, why are you talking only about women? Why? The men don't need this? I'm sure everybody will have this as a part of a question as to why did Dr. Anna choose this for women only? Aren't men involved with it at all? Listen to all dear women out over there and the men present as well. Yes, there is a need for special attention and care when it concerns women. And why? Yes, though the anatomical structures that we see are the same for the male and the female, you might be seeing them as, structurally different. No. Every structure that is present in the male body is equally present in the female body. Of course, certain are rudimentary and certain are in use in both of them as such. But when we see from a lock and key perspective, when a man and a woman meet each other, the mounts that are in the women are not present in the men, and the things which extend out from men are not present in the women, so that they can come together as one. They are different physically, yes. Emotionally, certainly. And their mental attributes are far, far more different when compared to a male. Why are they different? Because that is how the nature has created them. And they are vulnerable to any change. But from the Indian perspective, or from the perspective of the civilization itself, the last term that I'm going to use over here is that they are extremely, extremely precious. Precious because without them, we wouldn't be existing here today. So you can understand the depth in which the Indian society or the Indian culture, though you hear a lot about physical abuse, you hear a lot about the dowry system, you hear a lot about differentiation, but truly from the perspective of culture, from the Indian way, a woman is always rated precious and higher to a man. Now, what are the physical features? The body actually is tender. Quite a few of you all will say, no, we play sport, we do physical activities, I do gymming, I do a lot of other physical activities that is equally done by a male. Yes, you do it all. But at the end of the day, your body is certainly much more tender than what a male body is. And that is the creation. You are not responsible for that. It is the creation which has made it like this. Beyond this, the most important feature over here that you can see is the second one is the ability to conceive. No other male is able, or no male is able to do that. He doesn't have the ability to conceive. Though he contributes the sperm, you can certainly fertilize an ovum in a test tube. But for the growth and the physical development of the child, a newborn, you have to have a receptacle. And that receptacle is present in the woman. For those who are who have read the Bible, they will know what I mean by saying this. Yeah, Mary was the receptacle, as what has been said in the Bible. Similarly, in all Indian texts that we have, yeah, you see that a woman has been given special abilities and has been given a special presentation in the society. The third point over here is that the full body of a woman is curvaceous in nature. And when the body is curvaceous, that is when you know that the woman is fertile. Just before this, Anna had mentioned about women's health and how we all strive to get that hourglass figure, or how we strive to get that size 0 because the models present them as the best and the perfect bodies. But that's not really true. In the real sense, if you look from the fertility point of view, wherein a woman's body is considered to be fertile or the best body for having a baby, the body has to be curvaceous. The last point that you see over here is in the form of larger hips. Yes, when you compare the thorax of a man or the chest of a man and the hips of the woman. You can see that there is a V-shaped body of the man, wherein the chest line is very broad when compared to the hips, whereas in a woman, the hips are of the larger size. And people outside, in the outside world, considered having large hips as not looking good. But the truth is that the hips actually give away the sexuality of a woman. The hips actually describe how fertile the woman is. And that is why it is important that this reciprocation of a structure that is there between the male and the female needs to be understood well and does not need to be ridiculed as such. We have to accept this fact that God or nature, whoever it is, has created us like this. Now, the mental features which are different from a male, and the first point is patience. We all know that the women are definitely much more patient than than the men. When it comes to affection, you know, the mother and the child bonding is much stronger. That is, the umbilical cord which connects the mother to the child is much stronger, and that is why she can share it. In the Indian terms, we would call it vatsalya, or we would call it maternal love. Now, that is present in a woman, which is not present in a man so much. Then the ability to forgive. Yes, a man is finding it very difficult to forgive a situation or let go of a situation. Whereas a woman has the ability to move on in life. However hard, however difficult, however bad a person has been to her, she has a tendency, and it is a natural inborn ability to forgive, ability to sustain. Yes, you can see that. And that is why the marriages, which are arranged marriages in India, however hard or difficult it is for a woman stands by her husband, a woman stands by her family of the husband, unless it is intolerable, and sustains all the changes that take place in that. And the last one over here you can see is courageous. Courageous, you know, in history we've heard about a lot about women who are courageous. That is because some of them are glorified with it. But in the general sense, if you can see the courage that a woman shows right from the time of conception and childbirth. Childbirth is not a joke. It is such a painful situation, yet she endures all of that, and she shows full courage into bringing up a child of whatever quality the physical body of the woman is. You can understand that she will certainly look after her child or her family. That is the attribute of a perfect woman. And this is what makes them different and on a higher platform than a male body. Now, what are the 4 stages of life which we all undergo? This is what happens to the body, that we have 4 stages of life: the child, the youth, the middle age, and the old age. When compared to a man, the woman has got different presentations physically, mentally, emotionally, psychologically, socially, and spiritually in all these 4 stages. Whereas for a male, from the childhood to the youth and from the middle age to the old age, everything goes on the same platform as it would be existing. There are very few physical changes that take place in a male when compared to the entire different scenarios that we present in a female. Now, in childhood, I have used the first statement dominant in kapha. Now, this is an Ayurvedic term or a Sanskrit term that talks about softness, suppleness, coolness, heaviness, grossness of the body. So you can imagine water, and you can understand the qualities of water. These qualities are predominant in a childhood, whether it is a male or a female. But especially in a female, the body is tender, the body is soft, there is excess of fat. We all have low strength in the childhood, and definitely very low physical tolerance. When I talk about physical tolerance over here, we all know that the child cannot bear the slightest amount of pain. And that is because the body is tender. The child's body is vulnerable. When you hold a child, you see how cozy you feel or how nice you feel to touch the soft, tender, glowing body of the child. Yes, all over the muscles are not very well developed, and that is why you see the child has got a lot of fat. Fat, which is considered bad in today's world, is not bad at all for the body when kept in limitations. We talk about diets that are keto diets and talk about zero fat, but herein you see the entire growth and the strength is brought in by the fat that is present in the childhood. So these are the qualities of the body that we see in childhood. Later on, when youth comes, we have dominant in Pitta. The youth is dominant in Pitta. Now, when I say Pitta, Pitta means fire. Pitta means energy, very high energy to convert the outer material that you eat into physically absorbable material. Very high energy when I talk about, you can see these teenagers, they get angry very fast. You can see these teenagers, they've got this zest for living. You can see these young people, they move on very fast. So all this that I talk about, qualities of fire, it is unstable, it glows, it just moves very robustic. You all glow in your skins, you all glow in your beauties, you all glow in your intellect. All this is because there is an energy which is called as Pitta, which is responsible for initiating and converting. Initiating in the sense for starting a particular job. Like when you are young, you can study very fast, you can remember very fast, and you can bring it out on your books also very fast. So this phase is a phase wherein we all collect a lot of things for ourselves, whether it is physical growth, whether it is mental growth, whether it is social, psychological, emotional growth. Growth in all aspects, it happens in the youth. The physical growth hastens in the sense you can see till you're about 8-9 years that the growth is fast though, but there is no spurt. It is a steady growth that happens. But once you start changing in your hormones, or once you start growing up, or once the growth spurt begins, as you grow and mature, the physical growth shoots up very fast. Within a couple of years or 3 years, you can see the body grows up very, very fast, very rapidly. There is nothing that stops the body from growing unless you are nutritionally imbalanced, unless you do not achieve the right amount of nutrition. Then this is this, as say, it is an age wherein the male and female get attracted to each other very fast. So because the male and female get attracted, why is it? Why is it that they get attracted to each other? Yes, it is by nature. It is the age of reproduction. Yes, there is a certain age for it, definitely, according to the rules of physical growth. But this is the reproductive phase of the human being. And at this phase, you have a body that is absolutely beautiful, attractive. The males feel like looking at the females all the while, and vice versa, the females feel like looking at the males all the while. Again, this is it's an age, youth is an age of stable intelligence in the sense you can focus, you can concentrate, you can learn, you can acquire knowledge. All this is possible only when your intellectual capacities are stable, or when your intellectual capacity has got the capacity to absorb, draw, focus. Increase in physical strength. All of a sudden you can see that you are strong enough to lift weights, you are strong enough to do your gymming exercises, you are strong enough to do sport, you are strong. All this happens in the youth. And 20 to 30 years in a female is the peak of youth. This is the exact time when your growth tissues need more nourishment as such. The next is the middle age. Middle age is dominant in Pitta and Vata. Now, Vata is the energy of wind or movement as such. This is said to be the age which is Sampurna or completeness, wherein everything is complete. Your physical growth is complete, your intellectual growth is complete, your mental growth is complete, your emotional stability is there. That is the age wherein you say the woman is complete, wherein the growth has been absolutely proper. We can have a well-defined intellect. At the same time, the urge to learn new things is absolutely present. I have used two Sanskrit terms below, as you see. One is called as the utsaha, or the energy, and the second one is called as bala, or the strength. The utsaha or the energy is optimal between 30 to 40 years, wherein a woman goes out after completing all her routine works which are associated with her familial and social, as I would call it, responsibilities. Some people might call me wrong with that, but then that is what nature says, responsibilities. And she goes beyond that and shows more active participation in her professional life, in her social life, in her hobbies and everything else. And this is the time when the body of the woman is strong. And this age continues between 30 to 40 years. It's the peak time of it, but for a woman who has maintained her body in that years, the same middle age can continue up to 55 years. What is essential is for all the women over here to know that this is the time wherein you invest in your physical bodies. This is the time you take care of your physical bodies. This is the time you follow a proper diet. This is the time wherein you will be collecting energy, the same energy that you will be using after the age of 55, because as the old age starts in, you will see that the woman's body starts withering more. She loses her physical strengths and physical abilities, and she is prone to sicknesses more. And all this basically happens because woman does a very, very important job, and that is reproduction. She brings out one or two or more lives out of her own body. So you can imagine how much she has contributed out of her own body to get another body out. So this is what I mean by saying that it is essential for a woman to take care of her body between 30 to 40 years, so that the next part or next phase in her life, she lives a life which is disease free. Though difficult, it is possible. Vriddha, or the old age. This Vriddha or old age is in dominance of Vata. Dominance of Vata, that means the energy of wind is more dominant over here. And because the energy of wind is more dominant, all disorders that are associated with movement and other aspects of our disorders, they have predominance. Now, what happens in this old age is that the woman's health is totally dependent on her menstrual cycle. If her menstrual cycle is apt and proper and without any disturbances or difficulty, she tends to have a fantastic body which has grown very well and which can be taken care of in old age as well. Yeah, but once the menstrual cycle stops, that is when you can see there is diminution. Diminution means there is reduction. Reduction in the ability. What ability? Reduction in the ability to absorb nutrient materials from the food she consumes, especially calcium and iron. These two deficiencies take place, and these two minerals are very, very important. Important for what? Iron content is in the blood and calcium content is in the bones. So both these contents, when they start reducing, you can very well imagine what is going to happen. You will be losing your energies, and then your bones starts deteriorating. Your bones starts getting used up because the calcium in the body is used up by the female body, and she cannot replenish this. And because she cannot replenish this, the body uses up the source of calcium that is from the bones. And because of this, the bones start aching, paining. You have disorders of the joint. Then there is reduced physical strength, reduced capacity to work. And the third point that you see, it is all natural, I mean, there is a reduced appetite. Now, all this happens if a woman does not take care of her body in the middle age that we talk about. Then you see that these women with all these physical disturbances tend to become weak mentally. The body has got aches and pains. There is an increase or decrease. Some women tend to put on a lot of weight after menopause, whereas some women tend to decrease in size as such. This causes a lot of problems physically. For those women who have decreased in size, their depletion becomes much easily. And for those women who have increased in weight, they have got problems that are weight-bearing problems. That is, the knees ache, the ankles pain, the back pains. Everything happens because there is an increase in weight. This further leads to increase in worrying. A person feels worried more and more, and this leads to a lot of mental disorders. And further down, you have degenerative disorders. That is because already you have a lack of iron and calcium inside the body doesn't have the capacity to replenish the wear and tear because the appetite is also reduced and the body cannot get the same food material, get nutrients out of the food material it is eating. So with all these happening, degenerative disorders take place in the body. What is the most important features of a woman's body? It is childbearing. Childbearing, because without that we wouldn't have been present over here at all today. It is because you all have been born by your mothers that you all are here today. So the male cannot do it. The male can only contribute towards giving its seed. The entire 9 months, 9 days of bearing is done by the woman. So mind it, she has to be given the priority for that, and she has to be given a higher pedestal of existence than a male, because that is what is going to keep us growing further. If she has a physical body which is good, we see to it that the child born is very healthy. If she does the penance during the 9 months, 9 days, you can see the child born is intellectually, socially, physically, emotionally a balanced child. But the moment you have disturbances during that phase of pregnancy, you will see that the child born is certainly coming out disturbed. Now, how is the childbearing governed? It is governed by the balance of hormones inside the body. For those of you who are not students of science, but you must have heard about these terms, that we have estrogen and progesterone levels, which are contributory hormone factors which are responsible for maintaining the physical, mental, emotional, social, and spiritual health of a woman. I have added the term spiritual as well over here. The hormones. Now, where are the hormones secreted? Basically, the hormones are secreted in the ovaries that you have. But where does the initiation begins? The initiation begins from the pituitary gland, which is located in between your two eyes. If you can see me over here, I'm pointing it out over here, in between your two eyes. So the pituitary is responsible for the secretion of hormones which are present in your lower abdomen, that is the ovaries. And who controls the pituitary? It is a in your brain which is behind. So you can imagine how important it is for a woman to be using her brain functionally, to be having a balanced mental attitude, by virtue of which the secretions in the brain are going to affect the secretions of the pituitary, and from the pituitary they are going to affect the hormones of the sex hormones, or the estrogen and progesterone. I'm talking about this now because today's women are so stressed, because most of the women are working with computers, most of the women are working in the IT field, most of the women are working in different professions. They give in 100% of their effort for their professional life, and this is what creates stress. The stress starts where? The stress starts in the brain, and from the brain what you can see is the pituitary that gets disturbed, and because the pituitary gets disturbed, you have the hormones which are producing the sex hormones, the estrogen and progesterone gets disturbed, and that is where the entire sequence of disturbance of a female body starts. Are you with me? Do you understand what I say? If not, at the end of the session, please make a note and ask me a question on the same thing. But I am trying to keep medical terms away and talk in layman's terms as to how these things happen over here. Now, most important aspect is nourishment. Nourishment is something that we do not think about when it is a girl child or a woman. And it is the woman's natural tendency that she doesn't take care of herself, but she thinks she should take care of others. But mind it, ladies, if you are fit, we are fit. If you keep yourself strong, we naturally derive the benefits of being strong. Men are not strong mentally, but men all have dependency on the women. You believe it or not, it is a fact as such. Now, before menarche, that is before you start with your period, tomorrow you will all be having children, or you might be having for a child to eat that before menarche is that they eat a lot of dried form of what? Daisies, khajur, kishmish, jardalu, and figs are called as anjeer.
कवी
So
भुरगेपणातले
if these
कसलं
four
यादी
are included
ह्या
in the
कवितेन
diet,
सांगता
कवी भुरगेपणांत सवंगड्याक ना सवंगड्याक
there is a
वांगडा
disturbance. Somebody please turn off your mic.
खेळ खेळणे
Rashida, please keep your mic off. Thank you.
That is, yeah, dried dates, raisins, apricots, and figs. Now, these, why did I use this one thing as dried dates? Because anybody and everybody would love to have this because sweet to taste. Now, these have got energy capsules in small quantums, and they are easily absorbable kind of material which tend to increase the quality of blood, I mean, control the pitta, which is going to be happening next. Apricots develop the muscle tissue, and figs develop the blood tissue. Dates also develop the muscle tissue itself. So the next, these four things, along with all vegetables given, all the other aspects of diet, vegetarian or non-vegetarian, I think we are all aware of what it contains. But herein, I would like to give you small points which are doable for all of us. And these dry fruits, when they are consumed, help a lot in nourishing the body of a young woman as such. Now, during menarche, that is between the age of 12 to 18 years, the aim is to achieve regular ovulatory cycles with all the health and the anatomical changes. Sorry, I have mentioned paper over there. It is pepper, the first one, the second one. So it is hingu, that is asafoetida, pepper, methi is fenugreek, ajwain is caramwort seeds, gum acacia. Gum acacia is that dink that you get inside of a goon, shatavari or asparagus. Then things that will not increase your weight much, that is ragi, bajra, cashew nuts, sesame seeds, and jaggery. See, these are all not expensive things. These are all regular things that we can add to our diet. The millets that you can see over there are the cheapest form of what is available. We do not need those high content protein foods that we talk about outside. You will say that a poor man or a poor woman cannot afford this. No. Hingu or asafoetida is available in everybody's houses. Pepper is miri or kali mirch, which is available, which we use regularly. Methi seeds, as you all know, is available and not expensive at all. Ajwain to be added to the food. What does this do actually? These actually clear the pathways of flow of blood. If there is any blockage, if a person has a tendency to add on weight and block the channels of blood flow, then these four things that are there add up and open up the channels. It's just like, putting a little heat and opening up the pipe so that the flow is normal. Now, gum acacia and shatavari. Gum acacia is the dink. It is the richest source of most absorbable calcium. You don't need to go and buy a tablet of calcium, but gum acacia improves calcium absorption in the body and natural. So it doesn't have to undergo a lot of physical changes that what a chemical would be doing. Methi adds up to the growth of the bone as well as adds up to the blood formation in the body. Now, shatavari or asparagus is a known tonic for women. I mean, blindly from any aspect, what Ayurveda talks about, that a woman can eat shatavari. Shatavari is asparagus. In the West, you have sticks available of this during certain seasons, wherein people all eat it. Ragi is nachni, and bajra, as you all know, is bajri or the pearl millet. Now, these two millets have a tendency not to add on weight, but have a tendency to give you or provide you with the required amount of nutrients in the form of iron and calcium, along with carbohydrate that is provided by it. Cashew nuts are very rich source of calcium as well. Sesame seeds and jaggery. At the moment, it is the season for haldi kumkum in everybody's house. At the moment, it is a season because Shankranti is just being done, and you will see that at that time you give tilgul and say, what does this do? Sesame seeds are the richest source of vitamin D, and vitamin D is responsible for formation of bones or proper, maintenance of bone. And jaggery again gives you energy, gives you iron, and gives you a lot of satisfaction of eating, that it gives you a good taste of eating. Very, very important if you have to have good digestion and such. Now, what are the dietary changes that we need to do during pregnancy and postpartum? 2 times we've got. Pregnancy is the period wherein you are not alone, you have another body within you. So at this time of the year, you have to see that you eat properly. Eat properly what? Not food that is going to make you fat, but food that is rich in nutrition, food that is rich as a source of bioavailability. That means food that is easily absorbed by the body and can be consumed by the child as well. Food that is clean and devoid of hormones, food that is easily digestible, and food that doesn't cause constipation. So I could talk more and more about it, but the time is very insufficient. Now, postpartum, what happens? Postpartum means once the woman has delivered. Once the woman has delivered, what happens? The entire change takes place in the body. It is like having a new lifetime for the body. Almost 100% of what the woman had as her own nutritional best food is going into another body, and that body comes out and that body has to survive. So the woman prepares that by giving her best portion to the child that is going to be born. So postpartum, the woman has to recover back. If she has to, there are 2 activities that happen. One is lactation, that is, woman gives milk to the child. Where does the milk come from? Milk comes from her own body. Where does it get formed? As you know, milk is the richest source of calcium. The milk that is formed is derived from the food that the woman eats, as well as from the calcium that is there in the bones. So it is at this time that the woman needs food that is rich in calcium, that can easily be digested, that can easily get converted, and that supports lactation. And one of the most important things to remember over here is fenugreek, rice, and coconut milk. If you see, there are 2 things. Your milk, of course, is very, very important. But for those people who cannot afford milk as well, the poor of the poorest can certainly afford rice, methi, jaggery, and coconut. If these 4 things are consumed by a woman, then she draws in a balance of, improving the quality of her blood. She draws in a balance of drawing in calcium from the food that she's consumed. She draws in a balance of feeling self-satisfied, and the hunger or the appetite is also provided for. So it is absolutely essential that during these times, pregnancy and postpartum, the diet change. changes totally. I am not talking about anything fancy or anything expensive or anything that requires a lot of effort. I am talking about easy methods in which we can maintain. Now, the pre, peri, and menopausal phase. Yeah. Premenopausal is just when the changes start taking place, wherein your estrogen level starts going down. Perimenopausal, wherein there is a total disturbance between the hormones, and menopausal phase, wherein all your menstrual cycle stops. At this time, what is absolutely essential is diet that is rich in iron and calcium, because before that I have mentioned that estrogen, which is present in your bodies, starts depletion, starts getting reduced, and this reduced estrogen does not have the capacity to absorb, that reduces the bodily capacity to absorb natural sources of calcium. So because of that, the bones do not get repleted. That means the bones do not get re-nourished back. The calcium that you have used from the body, which is derived from the bones, they cannot get the calcium back because estrogen level is low. So what is essential is that you have a low calorie diet, because at this time you feel there is a difference in the hunger, difference in appetite. You suddenly feel hungry. Everything is haywire and crazy. So how you do it is by eating low calorie diet. And what is a low calorie diet? A diet which is rich in millets, a diet which is rich in vegetables, a diet which is rich in fruit. So low calorie and high nutrition, so that you have a tendency not to add on so much of weight. Lifestyle. I have added this, though this is not a part of our talk. What is essential to maintain is regular exercises. Now you will say regular exercises, I have to go to the gym and do it. Ladies and gentlemen, in the earlier years, you would not have so many fat women at all. Even if you see those women who are working in the fields, those who come to sell their vegetables, fish and everything, what is their physical sizes? They are absolutely lean, active, agile, light, and very rarely suffer from a disorder as such, because they do these regular exercises. And what are they? It's nothing but the routine jobs that we do. Earlier, we didn't have washing machine, we didn't have grinders and mixers, we didn't have vacuum cleaners, we did not have instrumentation or development in technology that would do all your work. So today what has happened is that we sit down and do all the jobs. That is not the way a woman's body was designed. She was designed to sweep the floor, so she would bend down and sweep, and swab the floor. She would bend down and swab the floor. She would pound the grains to remove the rice out. She would do grinding with the grinding stone. She would do a lot of these jobs which would involve in bending forwards and lifting things. So that was what would keep her fit as such. She would draw water from the wells. She would wash her clothes in her hand. So all these physical exercises, all this physical work were sufficient enough for the exercises. Nowadays, we don't do any of this thing. Times have changed, so we need to change ourselves. That means we need to do regular exercises. And of the recommendation I would give is just doing sun salutations or Surya Namaskars. That is sufficient enough. 12 Surya Namaskars are sufficient enough. Otherwise, for people who are interested in developing their body further, is yoga and meditation. The third point I'm talking about is application of oil. If you want a beautiful skin, if you want a supple body, if you want vata to be reduced inside, and if you want to maintain your youth, apply oil. The analogy that I would like to use over here is that you need to apply, your body doesn't rust. If you see a nail, the iron nail that you put inside the walls, if you leave it out plain, it gets rusted very fast. Within a week's time, you can see it getting rusted. But if you wrap it in a cotton that is dipped in oil, for the next 25 years that the oil is there on that, it will not rust. So that's the same thing oil does to us. So application of oil is absolutely essential, and proper sleep. If you don't get proper sleep, you burn out. And if you burn out, you are mentally stressed. You are mentally stressed, your periods get disturbed. Your periods get disturbed, your health gets disturbed. Everything goes haywire. Sleep is very, very important. Personal hygiene. Personal hygiene is recommended very much over here because a woman's body is easily prone to different forms of infections, especially of the urinary tract. Yeah. So personal hygiene I talk about in regularly changing their clothings. Inner garments need to be changed at least twice or thrice in a day, because that is where the whole story of infections begin. Maintaining the private areas, your private areas wherein you pass your urine from, at the same time you have your periods from the vagina and the entire area are areas which are very, very prone to infections. Now you will ask me, why is a woman's body more prone to infections than a male, especially in the urinary tract? The woman's body is more prone to infections in the urinary tract because the urethra, which connects the bladder to the outer junction, that is external urethral orifice, is just 4 centimeters long. Whereas in a male, the difference is that the males don't get urinary tract infection very often because their urethra is of 25 centimeters. So this is why a woman should be extremely careful in the toilets that she uses and see to it that she maintains the private area very, very clean. And oral hygiene. Oral hygiene, because the oral mucosa over here is responsible for your digestive capacities, both for male as well as a female. But since the sweetness is more over here in the females as such, the oral hygiene is absolutely necessary to be maintained. The last topic that I come over here to is grooming. Yes, women are supposed to groom. Women are supposed to look pretty, not because it is the fashion. The first statement, you look good, you feel good. And if you feel good, then your physical activities that are there, your brain feels good, and your brain feels good, your hormones are good. Your hormones are good, everything is good. So it is absolutely essential that you take efforts to groom yourself. It is absolutely essential that you make an effort to look good. The way today's Western world says that you wear any form of clothes and you wear all this clothes, I'm not being a feminist as such, but a woman has to look beautiful because she is beautiful. So she needs to take an extra effort because she has to groom herself, because there is nothing as beautiful presented as a beautiful woman presented to you, groomed very well. So you have to learn the techniques of grooming. No, it doesn't mean that you have to go to the beauty parlor and apply all that makeup. No, you have to see that you have proper hair care that is taken. You have to see to it that you have got proper grooming accessories, that you wear proper jewelry, you wear flowers, you wear perfumes, a little bit of color on yourself. And the last thing you have to avoid, conscious about. Both sexes, I would say, male and the female. When does one have body odor? See, the women who's pitta predominant will have it naturally. But if she eats food that is going to disturb the pitta in her body, then she tends to emit, it's like smelling blood out. Yeah, she tends to emit bad or foul odor. You have body odor when you don't keep your bodily hair removed or keep them clean enough for you. You have body odor when you eat food substances that are extremely strong odorously. You have body odor when you eat meats which are heavier for digestion, when your protein content in the body. So there are various reasons for body odor. Hair, it is absolutely essential that you comb your hair very neatly and keep them very neatly. You will say Indians knew about hair. If you go and see the carvings that are there at I think Belur and Halebeedu, these are temples in Karnataka. I was amazed to see that there are more than 1,000 hairstyles. All this that comes at the different beauty parlors you're seeing are not modern inventions at all. You have different beautiful forms of hairstyle, right from a bob cut to the sadhana cut to the fringe to everything that is there is present in 1,000 carvings put in hairstyles over it. So the Indians knew very well how to take care of their hair. Indians knew very well how to style their hair as well. Skincare. Your skin is the reflection of your inner health and your digestive capacities. Applying lotions and potions doesn't make a skin glow. Your skin will glow when you have your internal health, which is absolutely optimal. And for this, it is essential that you have a proper diet, proper quantum of water, and proper amount of care that is taken by application of various oils and beauty products on your skin, which are natural as such. Yeah. Beyond this, Ayurveda considers a woman to be Shakti, the mother source of creation, in whose lap all civilization is created. We are running short of time. I have gone 5 minutes beyond, I think so. At this juncture, I would like to thank you all for this patient listening of yours. I know I have gone very fast, and at certain points I have exceeded in my speed as well. But that within that limited span of time, I had to give you what is essential for you to learn about yourself, to know that you are different from a man, and you cannot compare yourself to a man because you are certainly at a higher stature than man. Though there is this fight constantly that is going on because saying that women are equal to man, I am of the opinion that women, you are higher than men because you all are the bearers of the civilization. We cannot do anything about it. So I hope this makes a little difference in your lives, and I'm extremely, extremely grateful to Anna for giving me this opportunity. Thank you one and all. The forum is open for question.
Thank you so much, Dr. Korde. I'm tempted to ask you a few, one or two questions, if that is okay with you.
Of course, please go ahead.
Yeah, these days, you know, all the girls, thin and fat, they are into crash diet.
Yeah.
Would you give some cautions about this crash diet in the long run?
Yes, certainly. What is crash diet? You know, you cannot add on weight, or you cannot remove weight very fast at all. Everything is a slow process. So crash diet is something that cannot be done at all. Crash diet is something that we cannot follow at all. Go slow. You are allowed to go into a diet. Go slow, but see to it that control your diet before you add on to the weight, no? And the easiest way of doing it is by drinking hot water. If you drink hot water before your meals, your tendency for people who tend to put on weight is reduced. Keep your diet well, keep your menstrual health well, and keep your exercise platform in a way. It is these three things are responsible for adding on weight. Please don't go on a crash diet because nutritionally you will be depleted and it's very difficult to get it back into action.
Dr. Korde, as far as thanks for that answer, because I'm asking on behalf of the people who are into this, and I see them into so many problems because they do this without knowledge. So I thought that if you can give a word of caution. Another thing that I wanted is that what are the things that they should, deficiencies that they shouldn't allow? Like, for example, iron deficiency, calcium deficiency, because nowadays, in the pretext that no time and in the pretext of dieting, people don't take full food. They'll just have one batatwada. They won't have proper food. So in all that, they skip lunch. They'll skip breakfast for sure, and no drinking enough water. How does this affect the calcium, iron, which are the most predominant deficiencies? Like, can you tell something on that?
Yeah, I will give you two easy tricks for that as such. You know that you bleed every month. So you know that since you bleed every month, you lose blood. It's a naturally known, it's not rocket science, it's an easy thing to understand. So you know that you require to supplement it back, you require to grow it, you require to put it on. Most of the women you find anemic over here. In India, it is a story. So what are the easy ways to do it? You all cook rice every day, right? So when you cook rice, you wash the rice. And when you wash the rice, what you need to do is see to it that the second washing of the rice, you store the water and drink it, right? So that provides you with lots of B complex, which is responsible for producing good amount of blood into your body. The second thing is that when you talk about calcium, eating methi seeds also gives you iron and calcium, But if you don't like both of that, then all that you need is get some guar gum or a dink that is available in the market, fry it in ghee, keep it in a bottle, just add it to anything that you're eating. I'm not talking about anything that is expensive or non-doable, but if you maintain this on regular basis, and eating ghee, pure ghee is very, very good for you because it maintains the nutritional balance of yours.
Thank you so much, Doctor, because you have given so much of importance to women, and you have actually put us on a big pedestal. Thank you very much for that. Such an elaborate and I should say captivating, enlightening glimpse of what a woman is after a long time. So nicely you have given, very invigorating. And the good takeaways are to take a proper diet and not to go for a crash diet. I'm sure that all the students and all other women who are attending this particular meet with Dr. Nilesh Korde as the guest speaker are really benefited by knowing he has given a very broad idea about women and the health, how to take care of their health, particularly about the periods and particularly about the stages from childhood to menopause he has gone and how the body changes. Very elaborate, very crisp, and the soft and relaxed manner in which he has presented is really appreciable. Now, on behalf of our college and all the students, staff, principal, and all the people who are involved in this meet, I would like Mrs. Akshata Samant to propose the vote of thanks. Akshata, please.
Beautifully encapsulated your years of knowledge and experience in a way that each one of us, our students, could absolutely understand and absorb what you wanted to convey. Thank you once again, Dr. Nilesh Korde, Professor and HOD, Rachna Sharir, BSPs, Gomantak Ayurvedic Mahavidyalaya and Research Center, Shiroada, Goa. Thank you, sir.
Thank you very much, Akshata, for that vote of thanks. But now I think that we should all put our videos on so that, you know, one photo can be taken. I think some students will take. So for the benefit of that, if you can put your cameras on, it would be good.
Yes. Till the time the students switch the cameras on, I would also take this opportunity to thank Dr. Anna Nina George, as resourceful as she has always been in roping in such an eminent and acclaimed guest speaker, Dr. Nilesh Korde, as the resource person for today's talk, and go ahead and thank GVM's Dr. Dada Vaidya College of Education for organizing such a wonderful talk. Thank you.
Yeah, I would add to that, Akshita ma'am, that special thanks to Diptej Vernikar, because in his, isolation also, he has helped to make this talk possible, which was a big question mark to me long back when he said that he's not well. But thank you very much, Diptej. Special thanks, though in your isolation, in your trouble, you have given the best that we can. Without your support, I don't think this program would have been possible, because your expertise and your heart and mind was required. Thank you very much for that. Thank you. Madhura, have you taken, anybody taken a photograph? Are we all looking good?
Yes.
Okay, thank you.
Let's all smile, yeah.
Thank you. Thank you so much. Thank you, Dr. Korde. Thank you very
Thank
much.
you very much for giving me this opportunity. I shall always be
After
there.
a long time. Yeah.
Yeah.
Nice to see you. Thank you.
Yeah,
Thank
nice
you very
to see you.
much.
Bye-bye.
Bye bye. See you.
Or any questions later on also, you can send
I'll
me.
send it to you. I'll send it to you.
Yeah.
Thank you so
Thank
much.
you, doctor. Thank you very much.
Thank you so much for the
Thank you.
opportunity. Lovely seeing you.
Thank you.
Thank you.
Yeah, thank you. Thank you. Yeah.
In fact, he is also saying thank you, Dr. Korde. Matthew sir is also saying thank you.
Yeah, most welcome. Thank you very much. It's been a pleasure.
Yeah. Actually we need to have more sessions, not only this one session. Eh? We look
Anytime.
forward to for yeah,
Anytime.
yes.
Anytime. Let's have it in person.
Thank
Yeah,
you. Thank you, Dr.
exactly.
Nina.
Thank you, sir. Thank you, sir. Thank
Bye-bye.
you.
Thank you.
Bye, bye.
Bye bye.
Yeah, thank you. 1 minute.